just speak to me a little about why employment specifically is such a area of concern for people that struggle in that way.
Generally speaking, employment, research has shown it's a hugely beneficial feature in a person's existence and life. Transformative in terms of giving somebody an identity, a sense of belonging, financial security, the choice that comes with income, but also beyond that, a social network, a reason for being, and those attributes of employment apply as much to people with mental health needs as anybody else. One of the difficulties has been historically that people with SMIs don't have the same equality of access to employment opportunities, and there's lots of reasons for that. There's stigma in society, and that is prevalent within people, especially with severe mental health problems, and the stigma that people carry themselves about mental illness. So it's external, it's internal. The scheme that we were fortunate to be a host of, and continue to be so, targets a destigmatising approach to mental illness. It creates an individualised approach to support people back into employment. And that's people actually with more complex needs. Maybe people who've had a long-term history of schizophrenia or a bipolar disorder. Maybe people with quite severe psychological vulnerabilities who may traditionally be labelled as having a personality disorder. So that the Twinings organisation have partnered with us. We've hosted their service, and it's been a fantastic success since it started. We've had some very good employment outcomes with limited investment.
Let me ask you for some specific examples of those success cases that you've mentioned there. So you're teaming up with Twinings to help people find that employment that you just explained is so crucial in so many ways for everyone. But there's some specific cases that come to mind. What are the jobs that you're seeing people ending up taking on? Is it, again, just across the board, or are there some specific examples that you can think of?
Yeah, I think what we've seen, we've got about 29 outcomes so far from the process of offering this support, and I wouldn't want to pin one down, to be honest, because we're seeing people getting jobs in all sorts of industries, and it reflects the nature of the different types of needs people have around employment, and people are suited to different industries. I think what's great to see is people who've been out of employment for a long period of time are getting opportunities to go back into work. So I had one chap who was unemployed for 5 years, and he's now back working, earning his own money, being part of a scene with a different identity, which is formidably powerful for him. And not only that, those are the hard outcomes in terms of what the initiative is set to achieve: employment above 16 hours. On top of those outcomes, there's been a lot of transactions with other people who are being put onto pathways towards employment, and there's been about 220 other cases who have had the support of the Twinings approach and the IPS model of delivery, and they're also being put onto pathways to employment. So whilst they haven't achieved employment yet, they're in a different place in terms of thinking about employment and thinking about their position in society. So it's quite a transformative opportunity that's been provided.
And it's been recognised most recently. It's been published today by Barnet Council. It's been recognised as a centre of excellence. From your involvement and your position, just finally, what does that mean for you to have that kind of accreditation, that kind of that kind of response and affirmation?
I think for me, I think it's nice to have it recognised that partnership working achieves good things for our customers, for the service users in our community. But more fundamentally important, I think, is the destigmatisation message that goes along with it. What it says is that employment matters, and that people and services and society needs to recognise that employment is important for people with lived experience of mental health conditions, and that we can achieve positive outcomes in this area. So I think it's more validating for us as an organisation, for our own employees to face their own stigma and challenge their own expectations around actually can this person that we're providing care services to reach a position of employment again. It challenges us to think about our own work as much as it does our broader community.